Hello everyone and welcome to an Upgrade Your OET Writing Special. My name is Sona and I'm a premium preparation provider from Upgrade Your English by Bose Learning. Today I thought we'd go through how we teachers mark your writing. Now, of course, I'm not an examiner, I'm a premium preparation provider. That means I've done extra study to make sure that my courses deliver good quality OET programs. And I wanted to show you how I go about marking my students' work to help them in their OET subtest for writing. First of all, I'm going to show you a piece of writing by one of my lovely students who's a nurse. And I'll show you the actual case study, and you can go away and look that up and download it and work through it yourselves. And the way to find great material from the OET itself is to search for OET and look for the occupationalenglish.test.org site. Go on to free sample tests here and then select writing. As you can see, there's 4 different kinds of writing that they have for you. In this case, we're going to be looking at writing test 1, and it was for nurses. And it was a case study all about Gerald Baker here. So go away, have a look through that, give yourselves your 5 minutes reading time and a little bit longer to practice planning. In my Udemy on-demand course, we actually go through how you select information from the case notes and go about planning. So we won't go into that now. What I'd like to do is to show you my student's letter. Here it is. It's 184 words. I think I wrote it down somewhere. And I'm going to give you 3 minutes just to read through it yourselves. What's good about it? What can my student improve? So 3 minutes after you've looked at the case notes yourself. So pause the video if you need to, go away, check those case notes out, and then come back, and we're going to spend 3 minutes just to read over it so you get an idea of the text. Here we go. Okay, so I hope you had a look through it, and as I say, I'm now going to talk you through how I would mark this. Of course, I'm not an examiner, and of course, everyone performs slightly differently in exam conditions, and of course, it depends whether you are doing the paper-based version or the computerized version. But just as an exercise, I'd like to go through how I would mark this. So first of all, let's have a look at the very basics here. And you can see this is all nice and clear. We have capitalization where appropriate. We have the nursing home name, the address, and then the date. The date, don't forget, you can either put it over here on the left-hand side or on the right-hand side. That's absolutely fine as well. No problems either way. You put the date as given by the OET test, and they'll always tell you which date to put down. In this case, it happens to be back in 2018. No problem, just put the date down as they tell you to. So we have the name here of the recipient of the letter, dear Samantha Brown. Lovely, nice and clear. And we have next the line. Again, very clear who is the patient, Mr. Or you could just put in brackets M or F for male or female respectively, and then how old they are or the date of birth, whichever is given in your case notes. Again, don't spend ages trying to figure out how old someone is. If all you've got in the case notes is their date of birth, put that down. Don't sit there and count up to 2021 and how old he is. That's not important. Okay, let's see how the student has begun then. I am writing about your patient, Gerald Baker, who underwent a left total hip replacement on the 4th of the 9th, 2018 to treat a worsening osteoarthritis. So here you can see there's a mistake because we don't need a, it's not a noun. Worsening is the adjective and then this is the noun, but it's general, it's a complaint, so we don't need an article here. Following surgery, he is stable and ready to be discharged. It will be appreciated if you can continue his aftercare. So, as a reader, I know immediately that this letter is about my patient. It's not a new patient, it's my existing patient. Great. This is his name. Okay. Why are we talking about him? Oh, yes, he underwent a total hip replacement. Of course he did. This was the condition he went in with. And what's the news about him? Great, he's now stable and he's ready to be discharged. But I have to continue with his aftercare. So all the information I need is given to me very neatly and very clearly. So this is lovely. It's a great opening. I know who it's about, I know why we're writing, and I know what I need to do next. I need to look after him further. Now, what I'm expecting from the rest is probably information about how I should look after him. In this case, the student has started with medication, and that's perfectly fine. And then she's gone on to talk about mobility here. You could, of course, have it the other way around, no problem at all, but as long as it's logical, as long as everything is grouped together correctly and logically, that's fine. So, Mr. Gerald, actually, I'm going to change that here. It should be Mr. Baker because we either have Gerald and use his first name or Mr. or Mrs. plus their family name, their surname. So Mr. Baker is taking aspirin, okay, and I have the milligrams. I have his other medication, both once in the morning, okay, and Panadol Forte, okay, which is 2 tablets as required, okay. So I have what he's taking, how often, and further medication and the dosage here. Now, what's wrong here? As you can see, there's quite a few things that's been corrected. Okay, so we have a spelling mistake with wound, first of all. It might just be a typing error, a typo as we say, but do be careful if you are doing the computer-based test, then give yourself time to check for typos. Of course, if you're writing as well, give yourself time to check over everything, but be careful of typos if you're typing. So he needs to have his wound dry and cleaned. Okay, so he needs to have his wound dry and cleaned daily. Okay, cleaned, ED, passive idea here. And the dressing kept dry, again, passive, to keep the skin integrity. Moreover, we don't actually need moreover here. We could just say he should have his hemoglobin monitored for anemia. Again, passive idea. So we have a few mistakes with the passive, which we'll come on to in a moment. And we have the milligrams currently. So instead of at the moment, he has, we've got 1, 2, 3, 4, 5 words here. Much more efficient to put in currently, just one word. Where you can, keep your writing minimal. You don't need to use beautiful language to show off your skills. Actually, it's much better to keep your writing factual and efficient, and that's one of the criteria actually to fulfill, making sure that your reader can read things very easily. They don't have time to read 5 words when one word will do. So just keep these passives to one side. We'll come back to that in a moment. Let's move on. So as I said, this is all about his mobility now, and it's really clear from the opening that we've changed topic. We're no longer talking about medication, we've moved on. So great opening. He has good mobility post-operation, nice, but he should continue with the series of stretching. So we don't really need to say do here. And range of movement exercises started at hospital. Okay, so it started at hospital because it makes it clear that it's not a new program that's needed. The nurse doesn't have to devise a new program. This is just the program that he started at hospital, and he should therefore continue. He should avoid weight bearing with the use of a wheelie walker and wedge pillow, which we have provided him. So very nice here, because we have this idea of what he shouldn't do and the equipment that the hospital have given him to help him not do this. So we've combined 2 ideas, so that's nice and efficient. He should also use the toilet razor. Actually, that's a spelling mistake, I'm pretty sure. And I think it's just like that, toilet razor that we have hired for him for 2 weeks. So again, this is explaining that he also needs another piece of equipment, but don't worry, we've already got it for him. You can see here that I've crossed out this idea about doing occupational therapy, but we need to put that in. And I think we can put it in here, or we could put it in as a follow-up. So this is what the medication he's on. This is his current state, and now we're going to talk about his future needs. We have booked an appointment on the 21st of the 9th to remove the staples, and a follow-up appointment for FBE and UEC at City Hospital Clinic. Please consider him for occupational therapy as required. So now we've got all the future ideas together. And to conclude, if you need further information, please feel free to contact me, yours sincerely, Charge Nurse. So there we go, really nice, lovely, logical layout. It's very clear, everything about care is in here. There are a few mistakes, as I say, about spelling, and also quite a few mistakes about grammar. So let's have a look then. In terms of purpose, the purpose of the document is immediately apparent and sufficiently expanded. Yes, I think it is. Right at the beginning, we have what the reader has to do, and information about the care continues in each paragraph. So that's great. If it were me marking, I would give that a 3. Just to remind you, I'm not an examiner, I'm a premium preparation provider, but that's what I would give it. The content, according to me, dropped a little bit. I would give the original letter a 5 because sometimes it wasn't clear who should do what, the occupational therapist and the exercises, for example. Remember, I had to put in that these exercises aren't something new, they were started at hospital. And also to do occupational therapy, well, who should organise that? Is it the nurse? Is it something the hospital has done already? There was also something missing, possibly about looking out for signs of dementia, which you could put in if you think was important. I think some things are missing. They're not necessarily inaccurate, but they leave the reader thinking, oh, who should do this? Has it already been organised, or do I need to do that? So something to bear in mind when you're writing is not just to put in what needs to be done, but who has done it, or if it's already been done, then put that in as well. Conciseness and clarity I thought was very good. The length of the document was great. It was 184 words, which is perfect. There's no irrelevant information included. Of course, the temptation here is to write all about all the treatment he received in hospital, but in this case, is it important for aftercare? No. And my student hasn't included that, which is great. The information is summarised effectively and presented clearly. Yes, I think so. So for me, again, this is a really high score. And the genre and style, again, is very high. It's factual, it's clinical, technical language is displayed, abbreviations as necessary, HB, for example, and polite language is used appropriately. So for me, that was all good. And then we have organisation and layout, and I think that was pretty good for my student. Remember, we had those 3 clear body paragraphs, which were medication, mobility, and then future ideas. I think I just put it down a little bit just in case the occupational therapy being thrown in the middle paragraph didn't quite work. So 6 or 7 there. Now, language. And this is where my students struggled a little bit because there were inaccuracies in language, and I hope you picked up on those, and they cause mine a strain. So when the reader has to stop and think, what's going on here? What does the writer mean? That's when you drop grades. And passives are normally used with either be plus past participle or have something done or get something done, which is less formal. So you wouldn't use it in a formal letter, but you would use be plus past participle or have something done. So he needs to have his wound dressed and cleaned daily, and the dressing kept dry, have something done, keep something done. Moreover, he should have his hemoglobin monitored. So that's what we needed, and that would have made it much clearer. So overall then, it was nice and concise. All the important information was there, so I told my student, well done. But my student has to be careful to make sure that it's clear to the reader who should do what has been done, who should do what does the reader have to do. And of course, be careful with those passives. So we've come to the end of my letter marking here. Don't forget, if you like these little videos, then please do press the like button, click on the subscribe button, and then forward this to a friend that you think might also like it. If you're interested in getting some discounts on our on-demand courses, then please check out the comments box below. Also, if you want to keep your medical English up to date, why not check out one of our medical vocabulary quizzes or one of our other OET guides. Thanks for watching and see you next time. Bye bye.